So this session it's to very briefly go through some of the key things that you need to think about locally for getting your systems ready to support the core requirements of the CARE Act around the core processes of adult social services departments. So I have sort of assumed that there's a general awareness of that, but I'm happy to answer any questions as we go through. I've just realised I've got the old title of our group up there because we're actually no longer called the Information Management Group. We are now the ADAS Informatics Network, or AIN, A-I-N. So I'll have to change those for the next slide. And Terry Dafter is our chair, who's now digital champion is his title, and he's on the National ADAS Executive in that capacity. So anyway, going through the changes for April 2015. Now, all of the main IT suppliers we were consulted with in the late summer. So that's all of the suppliers in this region, and I know in this region you've got, I think it's 3 or 4 OLM sites, 3 or 4 Northgate Swift sites, and I think 4 Liquid Logic sites, 3 or 4, and of course you've got Durham with their in-house system, and I think there's 1 CareWorks site. Yeah. Now, we've consulted with all those suppliers and more late summer, and they all said their existing systems, basically, as long as you're reasonably up to date with versions, will cope with the core requirements of the CARE Act for April 2015, because a lot of the core processes aren't really changing that much, but you will have to do some reconfiguration, of course, in your systems to cope with the new eligibility criteria, the new assessment processes, potentially, and perhaps new formats of care plans. So the focus is very much now on you folks locally to make sure that you've got the plans in place and the resources and the clarity from your business leads as to how you need to reconfigure things. You shouldn't, as long as you're on a reasonably up-to-date version of the core software, you shouldn't have to update your core case management systems for the 1st of April next year. So that's the good news. With the possible exception around DPAs, which I come to in a moment. And again, around personal budgets. I don't know how many of you read the draft guidance last summer and then the final guidance, but the final guidance I think is much clearer now in terms of what a personal budget includes. You may have to reconfigure that locally. You may be reviewing your RAS, your resource allocation systems locally, whether that's still fit for purpose for April 2015, but again, that's probably local configuration. There's a little detail on financial assessments that you need to be aware of, where there is a change in the regulations which wasn't highlighted very much by the Department of Health, but it has been confirmed in the final guidance, and that is the so-called better off calculation between couples and singles. I don't know if any of you are aware of this. You have to be a bit of a nerd on terms of financial assessments and how they work, but at the moment, you can do, if you're dealing with a couple, you can do 2 assessments of their means, one based on them as a single person, the service user, and one taking their resources as a couple into account, and then charge them according to which makes them better off. Under the guidance, you only do individual means tests from next April, so you'll need to be aware of that, and you may need to do some work to change that where people have been assessed as a couple. And as hopefully most of you know, you'll be doing a bulk recalculation of all financial assessments and all client charges around about March next year for the new financial year in line with all the up-ratings. So you'll need to check that your systems will cope with that. I've been trying to, that's only recently been confirmed in the guidance, so I've been trying to check with the suppliers whether their systems do cope or not, and I haven't had many responses yet. The ones I have had indicate that there may have to be some manual intervention before you do that bulk recalculation. I know, for example, some of you are Oxford Computer Consultants customers with Controc, and that's the case there. If someone has been assessed on the basis of a couple, you'll need to identify those cases and go in manually, get someone to go in manually and change it to a single assessment. So that's something to take away from today to check. I don't know how many people will be involved, but there might be a fair few in some authorities, and therefore some people will be worse off as a result of this change. I won't go talk through all the rest of it, but the key questions for discussion at your tables are, so are you now clear it's November now. That's not very long before the 1st of April, and you'll need to potentially retrain staff in processes. So are you clear, as informatics professionals, from your business leads, what processes they want you to change and exactly how? Or if not, how soon will you get that information from them? And then you need to think about, well, how much effort is involved in reconfiguring it locally? Do you have the skills to do that in your particular system? And you need to retrain your users. But there may be some areas where you want to upgrade the core software. The obvious one is deferred payment agreements, and we've been flagging that up nationally in ADAS for over a year now. So most of the suppliers are offering upgrades to their deferred payment agreement functionality where they offer that. So the two leading finance suppliers of Abacus and OCC are just incorporating the new rules for charging interest, which is quite complicated. They're incorporating that free of charge under support and maintenance in their existing products. So if you're already using those products for handling DPAs now, that you will be able to do so going forward, and you shouldn't need to. Well, you'll need to take the software upgrades that they're issuing over the next couple of months, but you'd probably do that anyway for other finance changes, and you'll be able to use that functionality. If you're a Northgate customer, they're developing a DPA module, I believe, which they'll charge for because it's a completely new module. If you're an OLM customer, what they told us in the summer was that there was no demand from their customers for a DPA module because their customers had other ways of handling DPAs. I've since heard on the grapevine that they're reconsidering that, but you might want to check that out. Obviously, it's a little bit late in the day if they haven't already started developing it for next April. But of course, the volumes are fairly low, so you might be able to come up with some other interim arrangements. And then there's continuity of care. So there are some specific requirements in the Act that means that when someone moves from one authority to another, the first authority has to transfer a certain amount of information to the second authority. Wouldn't it be nice if that could be done electronically, at least in terms of the first authority being able to hit a button and the social worker there to generate a PDF output with the latest assessment and the support plan? That's the core information that could be securely emailed to the second authority. And most systems actually, sadly, don't very easily allow social workers necessarily to do that. So you perhaps need to check that out. But again, the volumes aren't great. And you've probably got some local workarounds for that. But on all of this, you need to just make sure that your Care Act leads have assessed the volumes involved, particularly around DPAs, and what system you're going to use. And you might have just some manual data loading, potentially, if you're moving to a new DPA and you want a DPA system and you want to continue managing the old DPAs under the same system. I'll just pause there, I think, for a moment. Is everyone clear around DPAs? Do people have approaches, plans in place for DPAs, handling DPAs? Or is it not an issue for a lot of you because the volumes are so low? Or any comment? Saw you nodding, Sarah. You sound like you've got plans. Put you on the spot. Yeah. Right. Maybe something. Oh, right. Okay. Right. Fine. So then looking ahead to 2016, around where the big change, of course, is the introduction of the so-called care account, which is the cap on the total costs of care that anyone will need to pay during their lifetime. And that will require system upgrades, and you'll need to start thinking about that now in terms of planning your upgrade process over the next year. All of the main suppliers are developing care account modules and functionality. Mostly they're doing that under support and maintenance, I believe. That's what they told us. So the recommendation is that you'll start accepting applications for care accounts from existing self-funders around about this time next year. And probably your existing systems will cope for an interim just in terms of accepting applications. So the process is the same. You have to carry out an assessment for existing self-funders to see whether they've got eligible needs. some sort of check on their means to check that they're not eligible for council-funded care. But then from April 2016, you'll have to start processing those care accounts and metering the costs according to the independent personal budget figure that you've established for them. So you need to establish an independent personal budget figure when they apply for a care account, which then starts counting towards their cap from April 2016. So you need to start thinking about that and engaging with your suppliers to check that they've got plans in place. As I say, they all should have, that's what they've told us, fairly confident around that, and you'll need to just decide who's going to manage it, of course, internally as well. And we nationally are going to have another engagement with all the main IT suppliers in January to check what progress they're making and what their plans are. And then the final slide, before we open this up for further discussion, is, of course, the impact of the care accounts and the change to the financial assessment means that there's going to be significant increase in volumes of both needs assessments and financial assessments. This does vary hugely depending on your local demographics and particularly the local house prices. So Surrey have got the most extreme issue where 80% of the people who have an eligible care and support need actually are self-funders. And it's going to vary across this region. I suspect you'll all be significantly lower than that because Surrey is one extreme end. And your care act leads should have been doing some estimating of that by now, how big your self-funder market is, and therefore to what extent this is a problem. But don't forget the other factor is the raising of the capital threshold. So if you've got a lot of properties where the value of someone's home is below 118,000, which is the new capital threshold, then you'll have a big increase in financial assessments and people eligible for part-funded council care. And I expect that applies to a lot of people, a lot of authorities in this region. So you need to think about that increase in the volume and what processes you're going to put in place to handle that. So you might, for example, want to introduce more flexible working for people, or you might want to delegate some of the functions which you're able to do under the Care Act, some of the core social work functions of assessment, needs assessment, or financial assessments even could be delegated. And I was interested to just be reminded in the final guidance that they actually suggest groups of councils might want to cooperate to handle DPAs from next year in a separate organisation across multiple councils. And then the other thing is that you might want to promote more online self-service. So that's something that we've been saying for a long time now in ADAS. You need to start thinking about whether you should move to a degree of online self-service for those people who can apply for an assessment themselves online, maybe do a financial assessment themselves online, or their carers. And it's my view that this new cohort of self-funders it will be often the carers, the children, the daughters, the sons of the frail elderly who are my sort of age. They might be busy professionals, they're used to transacting online. They're the ones who will want to apply for a care account on behalf of their elderly parent, because they will want to protect their parents' capital and know that if they've got a parent with dementia, they're not going to be in a care home for 10 years and use up their entire capital and the inheritance, let's face it, of the children. So they're the people I think who will be wanting to apply for these care accounts, and they will expect to transact online and out of hours if possible. They'll be used to booking their holidays online. So it's a completely different cohort compared to your existing service users, and by definition they'll also be more well off than your existing service users. So particularly if you've got large numbers of self-funders, you need to start thinking about what you can make available in terms of online self-service around advice and information, first of all, and then secondly, whether you want to go that next step of allowing them to do some sort of online assessment of their needs and potentially their finances. And there are some councils that are, particularly in the south, I know, that are very ambitious in moving towards that, and they see it as the only way of handling the increase in volume, because let's face it, you're not going to be appointing lots of new social workers. Now, for some of you, it may be less of an issue if the increase in volumes in this region are lower, and obviously you'll have to look at a business case to see whether that justifies it, but it's certainly something that you ought to be considering And of course, it fits with the whole government strategy of patients online and citizens being more empowered to manage their own care and support and health needs.